Hello everyone, I'm here to talk about the components of electronic prior authorization actually. The first part of the electronic prior authorization is to check if you need an actual prior authorization before the doctor can provide a service or a treatment to a patient. And that first part is called as coverage requirements discovery. So if you look at the payers in the country, every payer has a different set of rules for how they require a prior authorization to be submitted. That's number one. And every payer requires a different method of the prior authorization to be submitted by the providers to them to determine if the prior authorization is required. So this creates a lot of confusion amongst the provider community, and also it creates a lot of complexity in the way that how the prior authorization is compiled and approved. So the HL7 has implemented an implementation guide called Coverage Requirements Discovery. So what basically is this Coverage Requirements Discovery? This implementation guide provides a standard way for a provider to check with a payer to see if a prior authorization is required for a service or a treatment or a drug that they're going to be prescribing it for the patient. So this standard, the coverage requirements discovery standard, it's basically enables the prior authorization queries to be integrated to the EMR EHR system. So if you look at the provider community, every one of them are using some or the other EMR EHR system. So this implementation guide, the coverage requirements discovery, can be easily integrated into the EMR EHR system's workflow. And the CDS, there is a technology that is being used actually to get the approval is called CDS hooks. The CRD implementation guide also enables the payers to let the providers know about the details or the information that they require from the providers to determine a decision of whether to approve a prior authorization or not. So if you look at the implementation guide standards, the CRD implementation guide requires the patient to share the following information. That includes the coverage information of the patient. It includes also the decision from the payer to the provider suggests or recommends the providers to take up alternate lower cost drug products or alternate lower cost treatments. It also describes the list of documentation that needs to be submitted as a part of the authorization request. It also defines what kind of forms and templates needs to be submitted as a part of the request. It also gives us the indications of what kind of prior treatments has the patient been provided so that the adjudication or the determination of prior authorization can be based upon that. And also the implementation guide is designed to allow for the basic capabilities and to subsequently build new features over time. So these are the components. So in short, coverage requirements discovery is being used to determine if a prior authorization is required for a treatment or a service for a patient. So this is the first component of the electronic prior authorization, and the implementation guide is defined by the HL7 standards. Thank you.